The applications for our new College of Pharmacy were up 35% over last year, and overall, all of our health fields, it was an average of just over 25% increase, and we're still receiving applications every day. UNE, another way that we're trying to build and strengthen the health professions is by working closely with the community college system. The Maine's community college system is the second largest healthcare educator in the state. It graduates over 500 people each year in 28 different healthcare professions. John Fitzsimmons recently told me that his healthcare programs are at capacity. And Jim Ortiz at Southern Maine Community College here in town told me that they have a 6-semester or a 3-year waiting list for their nursing programs. It's interesting, the system has seen a 50% increase in students going on to 4-year degrees after they leave. So they're transferring and continuing their education, which is what always was the plan, to offer this as a stepping stone for some students to move ahead in their education. Jim Ortiz told me that UNE is the largest private transfer school for Southern Maine Community College. 58% of all their transfer students that go to a private university choose the University of New England. And I think this is a great example, Jim and I were talking, of a public-private partnership where we're educating healthcare professionals and we're doing it in an economical way for our state. Healthcare education in Maine is important, but it doesn't help if young people don't stay in Maine after they graduate. The National Science Foundation has funded a project for UNE to introduce high school students to health and science careers. And by bringing them on our campus, we hope to show them that there are great opportunities for learning and for careers here in our state. Our College of Pharmacy that Ron mentioned really demonstrates that an investment on part of the university, the community, and the state can be a shared success. We give Maine students in the top half of their class, so entering Maine students in pharmacy, if they're in the top half of our entering class, we give them a $10,000 University of New England scholarship. This means they can go to pharmacy school for less than $20,000 a year and graduate with a career that pays them well into the 6 figures. We think this is a great investment in Maine, and we're trying to remove economic barriers to education and create in-state opportunities. As Ron mentioned, we were really thrilled last November when the city, it was the first time they had given the Economic Achievement Award to a not-for-profit organization. And we really think that once we're at full enrollment with our College of Pharmacy, we expect that it will exceed $100 million in economic impact. That one college alone, one of our 5 colleges. And that's how important we believe that new building on Stevens Avenue is going to be. Healthcare research is also a significant contributor to Maine's economy. Our Neuroscience Center is building connections with Maine Medical Center in Portland and Scarborough and their researchers. Dr. Ed Bilski, who heads that center for us, has 2 spin-off biotech companies, and these came out of research that he did in our labs at the University of New England. These spin-off companies are part of the creative economy that was described in the Brookings Institute report, which I think many of you read. But beyond the educational and research benefits, as I said, higher ed is big business, and UNE is running a major enterprise. We'll just look first at the University of New England's economic impact. We spent $140 million this year to operate our Biddeford and Portland campuses. We bring tens of thousands of students and visitors to Maine. UNE attracts 3,000 non-Maine students who spend over $30 million each year in our state. And these students bring 21,000 visitors who spend $6 million each year coming to and from campus and for those basketball tournaments and athletic events. All of this spending enters directly into the Maine economy, creating sales for Maine businesses and jobs for Maine's workers. The total impact of UNE's investment, operations, students, and visitors amounts to more than $440 million annually, and that number is growing. Higher ed is big business in Maine. This economic impact story that I just told you about UNE is repeated over and over with every college and university in our state. All of these schools that you see before you have contributed significantly, not just to educating Maine's future workforce and leaders, but to building Maine's economy. The importance of keeping student graduates in Maine, as I said earlier, can't be understated. UNE is building a long-term investment with our students. We know over the past 30 years that if we have our DO, our osteopathic physician students, do a residency in the state, 66% of them remain here and practice. So using this 66% retention rate, we asked Chuck Lawton, who's with us today, an economist from Planning Decisions. Many of you know Chuck. He writes a column in the Maine Sunday Telegram. He did a study that looked at the lifetime economic impact of a sample, one single class that would include 125 physicians, 100 pharmacists, this is what our classes are now, and we added 40 dentists because we're planning to open a badly needed dental school as well. At average Maine salaries, the lifetime earnings for one class is $439 million. And Chuck tells me that this is a conservative number because he's a conservative guy. So, but I think it's really it's an amazing impact, and that doesn't include the nurses, physician assistants, physical therapists, all of the thousands of other health professionals that we graduate. And if you take, that's just one school, UNE. If you look at the impact of all the healthcare professionals, I know that the new president of Hudson's here, in the Maine system, in the community college system. If you look at the graduates of all Maine's colleges and universities, then you can begin to understand the critical collective economic, educational, and social benefits of higher education in Maine. In the aggregate, we are contributing billions of dollars every year to the Maine economy, and that's good for all of us. Looking forward, we must all work together to drive Maine's economic growth and address our health care needs. Access to care, particularly oral health care, is a real problem in most of the state. The Pew Charitable Trust released a report last week. Many of you probably saw that. It showed that only 37% of our children on Maine care are getting adequate dental care. That means 2/3 of those children do not get adequate care. UNE's proposed College of Dental Medicine would not only meet this desperate need, but will also create financial benefits around the state. And this to me was amazing, all 16 of Maine's counties are underserved in the area of oral health care, and 200,000 Mainers every year go unserved, not underserved, but unserved for dental care. The result is increased health care costs in our emergency rooms, lower productivity at work, all of this due to oral health issues. The story is really tragic. I had an employer in the northern part of the state who told me that he hoped we built the dental school because when people came in for jobs and he interviewed them, he could tell if they were from Canada or Maine because the people from Canada had all their teeth. And no matter how qualified the Mainers were, he had to put them in back of the shop jobs. He couldn't put them in front with the public. He had to give those jobs to the Canadians, and it really bothered him. He wanted to give those better paying jobs to Mainers, but just didn't feel he could. We want to start a dental school with a unique model that partners with hospitals and clinics around the state and would provide 60,000 patient visits a year in Maine. That's not counting our Portland clinic or what our graduates would do. These would just be our training clinics around the state. In conclusion, higher ed and healthcare in Maine are two growing clusters that together will continue to provide the tools for economic growth and prosperity. And at UNE, we're building on both those clusters. We believe that if we work together, if we partner, we can build connections that ensure that Maine and its people are healthy, that our economy is strong and growing, and that our children have bright futures here in this beautiful state.